Hello, hello, welcome.
Yeah, hi.
Thanks so much for joining us today. So this virtual open house. Oh, my name's Ashley Chile, so I should introduce myself. I'm the Associate Director of Admission, joined by Michael Walker, who is the Director of Admission for this particular program, and Dr. Schimmels, who's the Program Director. So this virtual open house is for psychiatric mental health, our post-grad certificate in this particular area. And I'm going to pass it along to Dr. Schimmels, who can tell us all about this particular program. And then if you have any questions at the end, we'll leave some time for that as well.
Yeah, thank you. Well, thanks for joining us. I'm excited to be here to talk about the Psych Mental Health Nurse Practitioner postgrad program. And feel free to keep your camera off, or if you want it on, we'll have questions at the end. So I'm going to go ahead. I wanted you to see my face, but I'll go ahead and put the slides up. All right, so you should see it now. So welcome to the information session on the PGC, or the postgrad certificate for the psych nurse practitioner. I just wanted to do a little gloating, I guess, at first about Emory. According to U.S. News and World Report from last year, our program, our MSN program, was #1 in the country, and our DNP program was #6 in the country. And we actually just found out here in September, just a couple weeks ago, that our BSN program was just rated #1 in the country. So that's really exciting. Now, the Psych Mental Health Nurse Practitioner program is actually the newest APRN specialty at the School of Nursing. We actually just graduated our first PGC cohort earlier, this just a little not too long ago in August. And the focus is primarily on the care management of outpatients, in outpatient, but we do cover outpatient, inpatient, across the lifespan for psych mental health nurse practitioner. And part of that is, part of the reason I think that we just got a program started here, and in general, is there really are a lot of shortages for psych mental health nurse practitioners, and we're in demand even more than ever. So this is just information about the state of mental health right now in the United States. Like the prevalence of mental health and substance use disorders is high, not just for adults, but for child and adolescent as well. So you can look at the numbers. And so mental health, substance use disorders, or a combination of both. But as you see on the right-hand side, the gaps in access are really high. So 77% of U.S. counties experience a severe shortage of mental health providers right now. That's pretty significant when you think about the need. And I think the need, I've been in this profession for a couple few decades now, but it really has changed over time, that I think that people are seeking help a little more and looking, to actually get help more. And I think our stigma about mental health and mental illnesses has changed over time significantly. And so that need is great, and that's a good thing, but we really aren't keeping up with the demand as far as the gaps in the care. And then you can see too, about only 60% experiencing mental illness receive treatment. And that's for a variety of reasons. Some of that is related to the availability and the access of care, but some of that still has to deal with other things like stigma, or not really knowing where to get help. And then when you look, though, down, only 1% of adolescents and adults with any kind of substance use disorder issues get help. And so those are pretty significant. So that really is where psych mental health nurse practitioners come in, is to make a difference in those numbers. So currently about 60%, or almost 60% of Georgians experience a shortage in mental health access. So that's pretty significant across our state. And then Georgia ranks 48 out of 51 in access to mental health care across the nation. Again, that's pretty significant with why we have such a need for more mental health providers, and specifically psych mental health nurse practitioners. If you look at the distribution now, everyone in the PGC program is coming in, they're all coming in as another type of APRN. So when you look at nurse practitioners, though, specifically, only about 6.5% are psych mental health. Most nurse practitioners are family nurse practitioners, and then there's a list here on the left-hand side of some of the numbers for other types of nurse practitioners. And this slide I put in here, this is some work I've done really as someone who's done work in the psych mental health nursing and psych mental health nursing in general across the country, different services, looking at what are some of the things. It's not just necessarily about access to care, but it's how we give services. It's how equitable are our services. Some of our patients, unlike maybe patients in other areas, there's a lot more social aspect, a lot more behavioral aspect. The Surgeon General had just put a report out about loneliness and about isolation and things like that. And those are the types of things that really impact our patient populations. And then also something else that we, as we, you know, in the psych mental health nursing profession really need to look at is advancing the workforce, is really looking at what we're doing to make sure that we're teaching and training well. And that's part of Emory having a program as well. So there really are a number of things that contribute to what's going on in kind of the landscape of psych mental health illness and psych mental health issues across the country right now that I think that psych mental health nurse practitioners can really help with. And so this was just a little bit to introduce the our team here. Of course, you're already meeting me, and I go by Ellen, and I'm Ellen Schimmels. I'm the interim program director right now. I do have a clinical practice at Spring Health, and I lead the psych mental health nurse practitioner specialty courses. My areas of expertise are a lot of different types of trauma-informed care. I do a lot of work with anxiety and PTSD. I served in the Army for almost 23 years, active duty. So I had a lot of experience with working with patients with PTSD and trauma-focused and trauma-related illnesses. Also do a lot with military veterans still, and then individual and organizational well-being and nurse curriculum development. Dorothy Jordan, she is one of our founding program directors. She actually leads the Blake Scholars program and does work with our DNP students and our Blake Scholars. She practices at the Marcus Autism Center and then Camp Sunshine, which is a nonprofit that she had started many years ago that works with is a camp really for adolescent and child patients who have cancer and have issues with cancer and who are in cancer treatment, and then more of a behavioral and psychiatric focused camp for them to participate in. And so her areas of expertise are child and adolescent and working with that psycho-oncology. And Aparna Kumar, she actually has a joint appointment in the School of Nursing and then at the Carter Center. And she leads our clinical courses and intensives and immersions. Her areas of expertise are listed here, but she has expertise clinical expertise in across the lifespan, inpatient, outpatient, child, adolescent, and then specializes in child, adolescent, maternal, perinatal mental health. And then she also does work with supporting nursing workforce development with her work at the Carter Center. And Lakeisha Jackson, she is our senior program coordinator. And so she does all the clinical placement for the PMHMP program. And I'll talk a little more about this later in the presentation. So you're probably wondering, we do have students across Georgia, but across the country. And she aids in clinical placement. We do ask that people, if come in with an idea, if they have ideas of where they're going to have their clinical placements and places that they've already contacted and things like that. And then she really helps coordinate everything having to do with clinical placements because I think clinical placements tends to be one of those things that people are always worried about what the hours are going to be like and what that's going to involve. And so she's amazing. Um, I do have a link here at the bottom where the clinical placement office has a video, and it's a really lovely video, and it's nicely done about an introduction to them and what they do for our students. And a little bit of a transition. Our program mission is really to graduate exceptional and therapeutic clinical leaders facing increasingly complex healthcare landscape, and to train exceptional clinicians, exemplary critical thinkers, and effective therapeutic communication communicators with populations across the lifespan. So I think that that says it all because I think it's important that we do the students that we work with and that we're graduating that they have that clinical acumen, but also are really healthcare leaders because of this dynamic and complicated healthcare system that we're in to really help people navigate that. So the postgraduate certificate plan of study is a minimum of 3 semesters, and that just it is 3 semesters, but that would be if something happened where you needed to um, either extend that, but the program is based on a 3 semester model, and that's based on a custom gap analysis to make sure that you have everything that you need to start the program. So it's 26 credits. There is opportunities to take other courses, but the base program is 26 credits with 720 precepted direct clinical hours. 45 hours of simulated either on-site or virtual experiences. So to make things very flexible, we do have no more than one on-site in a semester, where you're coming in and doing in-person simulated events and then more immersive kind of experiences. But then we also have virtual class conferences, and we make that flexible to kind of meet people's schedules. And then also we're doing that on Zoom, and then we have simulated events that we also do on Zoom now. And how the clinical semesters work is the number of hours that you have in a clinical semester builds over time. So that first semester there's 180 hours, then 240, then 300 on your last semester. And how that kind of looks then is basically the 3 semesters layout where you have one didactic course with some simulation component and a clinical course, and you have this didactic and clinical course each semester for 3 semesters. So this is how the program ends up laying out with it, which is the same information I had just mentioned, 26 credits, the 720 hours, and then 45 simulated hours. Some tips for the program. Our foundations are on mutual respect, professionalism, punctuality, also a spirit of inquiry. In mental health, I think more than any other profession, it's really important to have a lot of self-awareness, to be curious, that curiosity that really goes into how we think about things and how we talk to and take care of patients. And then part of this is growing colleagues, growing people who you're going to have in your network that you'll continue to um, you know, talk to and continue to use as support throughout the rest of your professional career, hopefully. We do ask though that email is important, and that's a way that we communicate that you're checking that daily. And then I just wanted to put here a little something about the dress code when you're when you're coming in person or when you're in clinical practice, that the expectation is business casual, no scrubs. We don't wear scrubs or white coats, things like that, typically in mental health areas. And then, of course, having your school nursing name badge on. And there are a number of other experiences as well. In the clinical realm, we have sites in inpatient, outpatient, adult, child, emergency, different rotations in addictions, and telehealth with the VA, global mental health, and service learning trips. And then we do offer the Neuroscience Education Institute Master Psychopharmacology certificate as part of the training. So you walk out with that. I also wanted to mention that we in psych mental health have, until just recently, always had only one accrediting body, and that was ANCC, the American Nurse Credentialing Center. And so just in April of 2024, the the American Academy of Nurse Practitioners, AANP, came online now with a psych mental health nurse practitioner certification exam. So you can take either exam, and that's really, and either one are going to get you, to be certified as a psych mental health nurse practitioner. And our clinical rotations again occur across the lifespan. So you will have hours in child adolescent as well as adult, and usually some focus on gero as well, or older adults. Placements differ, so we don't want people to have the same placement for all 3 semesters because we want them to have some variety. We want them to work with different people, see different even EHRs, different electronic health systems, or even different systems, just to see how things function, how policies and procedures are followed out, and other things like that. And it is possible that you'll be traveling. Um, up to 150 miles from the School of Nursing, that clinical placements, and that really is working with Lakeisha. And again, sometimes we have people who are not in the area at all or not in the state at all, and we have we help them with their clinical placements in different areas as well. And so, but there is the potential for distance and traveling within the state for clinical rotations. There are housing and hotel assistance that's offered through the Area Health Education Center, AHEC, and you must be able to have your own transportation. Rarely in this kind of program, sometimes, in undergrad and maybe programs that you've had, are there multiple people at one place? And a lot of times we don't usually do that. We have that students are maybe working as the only psych mental health nurse practitioner student in that clinical site. So you couldn't rely on other people being able to drive you necessarily. A little bit about the application process. So you'll have to get official transcripts from each institution you have attended, letters of recommendation, and then either a CV or a resume, and then to write a personal statement. And that personal statement includes why you want to be a student in the Emory program, along with brief statement of your interests for practice, and then with an emphasis really on psychiatric nursing, what that interest is, what your experience is, and then what your career goals are for getting into the program. I also wanted to mention something which is our Blake Scholars program. So the Blake Scholars program is a collaboration between Emory School of Nursing and the Children's Healthcare of Atlanta to address critical shortage in child adolescent psychiatric mental health providers. And so this is for PGCs only, so postgrad certificate only, full tuition for nurse practitioners pursuing that postgrad certificate in psych mental health nursing, who intend to really focus on child adolescent mental health in the future. And so you complete the three semester program, and then you have a specific child and adolescent psychiatric training. So your third semester, where you have the bulk of the hour or the 300 hours in that third semester, is at CHOA, which is the Child Healthcare of Atlanta. It's at CHOA, and that really is to get that more immersive experience in a full child clinical placement, because you may see children in other places, but to actually have that experience there. And we work with CHOA in order to make that happen. And we have the preceptors that we work with as well. And so typically we award 6 of those a year. And so that's really good and helpful. And I'm excited about the program. And I think it's a really good benefit for PGCs to have that available. These are some additional resources. We have our School of Nursing student website. We have the student handbook. And then there's also a number of different kind of things that you'll get more clinically as you're in the program that are for reference, that you can look at and use as a resource. And that's pretty much all I have. Then I just wanted to have an opportunity. We look forward to being a part of this journey with you and any questions that anyone has. And I'm going to stop sharing. Thank you. Oh, good. We got cameras off and everything. Nice to see you.
Nice to meet you too. So I just had a question about the Blake
Yeah.
Scholar. So
Mhm.
would that be like a separate application from, like, I just submitted my application for the post certificate for psychiatric. So what would that be, like a separate thing that I would have to apply for to try to pursue?
I'll be happy to answer that. My name is Michael Walker, Director of Admissions here. And that actually, your application for admission will serve as your application for the
I'm
Blake
sorry.
Scholar.
It's Columbus Day and my kids are home, so it's
I
I'm
can
sorry.
completely
Can you
understand.
repeat it?
No problem. It's funny. My wife is juggling the kids at home, so
I
totally
told my
get it.
husband to juggle this, but clearly it didn't happen.
Yeah. So your application for admission is your application for the Blake Scholarship.
Okay, good.
So just to give you a sense of like timeline, so the whatever round you applied in for admission, you will get an admission decision. after we have reviewed all of the applications, all of the rounds, typically in March, like last year, I think it was March 15th, we actually released the decision for the Blake Scholars Program.
I
So
see.
I apologize in advance. There'll be a little bit of a wait, but we do
Yeah,
want to see the full applicant pool before
sure.
making the.
Makes sense. Totally. Thank you.
Oh, you're welcome. And we look forward to reading your application.
Yeah,
Yeah.
most definitely. I think you were the one who emailed me just recently, for the
I
letters of.
thought your name looked familiar.
Yeah, yeah. So it's actually on its way, so you'll be getting that soon. And then after that, is it just like then is it completed, or is there anything else I need to do after the letters of rec?
Oh, that's a good question. And I'll take a look. If I see that anything is missing, I'll shoot you a quick email,
Okay. Okay,
just
great.
so we can keep you on
I
track.
appreciate that. Thank you so much.
No, no problem.
Are there any other questions that anyone can answer here? I'm sure we can all answer questions for you, but questions about this particular program.
So I was looking at the tuition also. So for the 3 semesters, I don't know if I calculated this right, but it looks like it's going to be for the whole program around 50,000. Is that correct? Okay.
Yes, your math is correct.
Okay, good. Making sure. Do you guys offer any type of financial aid for this program?
Oh, another great question. So for our postgrad certificates, so because it's a non-degree seeking program
Right.
here at Emory, we don't offer financial aid for that outside of the Blake scholarship that we talked about. So students typically pay for their postgrad certificates, through a combination of personal savings, if their employer provides any kind of tuition benefit,
Mhm.
um, especially because the students coming through are working professionals. So usually their employer will pay something. I've seen students leverage active duty, military and veterans benefits whenever applicable. And then, students could do private loans. Now, I would say not like private student loans, but like private loans. And so they can
Okay.
work with their local credit union or, whatever bank they're doing their banking with. But usually I see a combination of those pieces if a student wasn't selected as a Blake Scholar.
Okay. All right. Thank you.
Oh, yeah, you're welcome.
Well, excellent. If you do find that you have another question, you can always reach out to the admissions office. Our email is nursingquestions@emory.edu, and we can direct you to whoever you need to. Michael also just put his email address in there if you need to ask any specific questions about this particular admission process. We'd all be more than happy to help you. Thank you, Michael. So thank you very much again for joining us, and hopefully we'll see you all soon.
All right. Thank you so much. Bye.
Thanks.